Hi everyone, this is Jason Profetto. I'm the Chair of Clinical Skills, and I'm going to be doing right now a short and brief orientation for MF2 Clinical Skills. I warn you in advance, I do have my dog here, so if he makes some noises or asks some questions, not to worry, I'll tend to him very shortly. Okay, right now he's chewing on a little stick. So, welcome to MF2. This is an orientation video for all the resident preceptors that are going to be teaching in MF2 for clinical skills. The purpose of this orientation is going to be a bit brief, broad, and just to sort of bring you to focus on some of the major things that we're doing in MF2, just so you're aware. It's not going to be anything in depth or complex, so it's just a straightforward video that you can watch. So at McMaster, we have the pre-clerkship and the clerkship, and the pre-clerkship is the first part or the former part of medical school that is focused on learning in tutorials, professional competencies, and clinical skills. So what you've been selected for is to teach clinical skills. Clinical skills is the focus on providing histories and physical examinations and starting to get into the diagnostic thought process. So the real focus here has to be on history taking and physical examination. How to ask questions, how to do a history, and how to do the physical examination and practice the different maneuvers. So in MF2, the focus is on GI, so gastrointestinal medicine, and endocrinology. So there will be a guide that is circulated to you through the administrative team, and it's going to have the actual clinical skills guide will have all the different aspects of a pre-clerkship that are included in clinical skills. But for you, the focus is going to be on Medical Foundation 2, or MF2. And you'll see a week-by-week guide. You'll see an agenda for each week. You will see the content that needs to be taught. And what you'll generally see is in the different MFs, we start off with a few major history and physical examination themes. So in MF1, we look at cardio, resp, and heme. And then in MF2, we look at GI, or the abdominal exam, as well as endocrinological stuff too, so like Cushing's, thyroid, that sort of thing, right? All the details about the exam, what needs to be taught, how to teach it, how to do it, it's all in the clinical skills guide. So the clinical skills guide is very inclusive, very thorough, it's very detailed, there's a lot of stuff in it, so you can look through that for some advice and guidance, and that's what I would encourage everyone to follow. And it's very important that this guide is followed week to week as best as you can to ensure consistency across all of the groups. So in terms of how MF2 is structured, we have three core components of the curriculum, as I was saying: professional competencies. So that's where we look at ethics, professionalism, communication, and that's every Tuesday morning. And then there's going to be tutorials, which are twice per week, usually Monday, Thursday, or Tuesday, Friday. The tutorial group is taught with a tutor, which is different than yourself. You are the clinical skills preceptors. The tutor will meet with the students twice per week. Those are the main core parts of the curriculum, in addition to the clinical skills. Clinical skills is once per week, and it usually lasts anywhere between 2 and 3 hours. So in the tutorials, they're going to talk more about content, discussion-based, chalkboard or whiteboard-based learning. And in professional competencies, it's also going to be a mix of large group sessions and small group sessions where they talk about different relevant themes around professionalism and ethics and other professional competency domains. The clinical skills, generally speaking, runs Monday to Friday-ish, one of those nights, usually in the late afternoon or evening. It's very important that students understand that this is a mandatory part of the curriculum, so they can't start missing this for interest groups or social functions and that sort of thing. This is a mandatory part. You are responsible for negotiating the schedule with the students. Work around your call schedule, make sure that it works for you, and make sure that the students are being flexible. It's nice if you're understanding and if they all have a big social function on Monday night, so maybe Monday night doesn't work. But in the end, it does come down to your discretion. It is a mandatory part of the curriculum, and students are not allowed to miss more than one session. If they do miss a session, then they have to fill out a leave of absence form. And if they miss more than one session, then we have to start getting involved as well, because remediation starts to kick in for the rules of the medical school. Each group is about 6 to 8 students, depending on the MF and the details of preceptors. But generally speaking, the preceptors are paired, so you guys will each have a partner and you should receive that information if you haven't already. And then with that, you're going to receive a group. So you're going to have a group of 6 to 8 students. And then within the next few weeks, you really should contact them. They will be encouraged to contact you in terms of setting up the first session. You can set up the session in the CSBL, so the Center for Simulation-Based Learning, which is at McMaster. You can set it up at MDCL, which is the Michael DeGroot Center for Learning, which is also at McMaster. You can set it up at one of your clinic spaces. You can set it up in a hospital room. You can set it up wherever you want, but it just has to be in the Hamilton or surrounding area. And it has to be accessible to the students as well. There's no set time that you have to meet. There's no set location that you have to meet. What happens is you have to organize that with your group, your co-resident preceptor, and then also ensuring that it works with your schedule and where you're going to be working, right? So in the past, residents have done a variety of things in terms of where they've held the sessions. But if you look at the guide and the frequently asked questions document, there's a lot of details of exactly where you can hold your sessions. As I was saying, what you have to teach is in the clinical skills guide, and there's a week-by-week sort of primer there that shows you exactly what needs to be taught. There's going to be 2 evaluations, a mid-unit and an end-of-unit. The nice part about the evaluations is one of the preceptors will be prompted via email, MedSys, which is our evaluation software, to do the evaluations. So there's going to be a mid-unit and end-of-unit. Now this is very important. When you provide evaluations, mid-unit and end-of-unit, nothing should really come as a surprise. All the feedback that you're giving in your evaluation should be given on a regular basis, on a weekly basis. You should be observing your students as much as possible, providing them direct feedback, direct observation, giving them pearls and little pieces of advice. My recommendation is that if there's going to be an issue or you have to address a concern, do it as soon as you can. Do it as soon as it comes up. Don't leave it to mid-unit, don't leave it to end-of-unit. You can give some time to observe students, but if there is an issue, you have to address it sooner rather than later. And on that topic, any concerns or issues with professionalism, it's very important that we make sure that these things are addressed right away. It looks like this little guy is whining. I think he might have to go out shortly. So, the clinical skills is one of the most popular parts of the curriculum. We're just going to do a quick pause right now. And you can go inside. It's got a real bathroom. So it's one of the most popular parts of the curriculum. Students love doing it. It's their opportunity where they get to act and be a doctor as much as possible, where they can actually interact with patients. So it's very important that they have a good experience and a positive experience. Now, when it comes to patient access, you can teach clinical skills by using standardized patients, which you can book through McMaster. You can use real patients that you have access to, or you can use patients that are at St. Peter's Villa or St. Peter's Hospital, which is an extension of Hamilton Health Sciences in St. Joe's. So it's best to practice on patients, to use patients, whether standardized or real. And if you look at the frequently asked questions, there's all details about how to book patients, how to get access to patients, how to use patients. The most important thing is that whatever you do, you have consent, you've explained it to the patient and their family, and they're okay with this, they understand what's happening, and it's a good, safe learning opportunity for the students, but also sometimes for the patients and the families as well. I want to keep this under 10 minutes just so it's easy to follow and to listen to, but if you have any questions, any concerns, you can look at the guide, you can look at the frequently asked questions, and most importantly, please email me or give me a call or shoot me a text or anything. My information is available in the guide, and it's jason@profetto.ca. Anything comes up, if you need anything, let me know. Otherwise, enjoy the teaching, and this is one of the best parts of the curriculum, so I hope you and your students have a great time. Thank you.